Hi and welcome. Every day, millions of people take medications without realizing that mixing them with the wrong foods or drinks can be dangerous. In today's video, we're breaking down one of the most surprising food-drug interactions you need to know to stay safe. A drug interaction happens when a medication reacts with another substance, another drug, food or drink, or supplement. This reaction results in two consequences: a decrease in the effectiveness of the medication, or an increase in its toxicity, which can cause serious side effects. In this video, we're focusing on one specific food that interacts with several commonly prescribed medications and how this happens. Grapefruit juice. Grapefruit is a liver enzyme inhibitor, meaning it slows down the breakdown of certain drugs by the liver, around 50% of drugs. This leads to an increase of the amount of the drug in the bloodstream, sometimes by 20 times the normal amount, resulting in increased toxicity of the drug, manifesting as serious side effects. One thing about drug toxicity to keep in mind is a core principle in toxicology and pharmacology, which is a saying by Paracelsus: all things are poison, and nothing is without poison. Solely the dose determines that a thing is not a poison. Or in short, it is the dose that makes the poison. This principle applies to every drug's effect in relation to its safety. Every medicine can act as a poison if dosage is not respected and monitored in accordance with how the body responds to the treatment. In the case of grapefruit drug interaction, the dosage, although being within the norm, is amplified within the body to the extent of a potential overdose. An overdose is poisonous. An underdose is ineffective. The takeaway is, the dose is not only what is on the label or what is prescribed by your doctor, it is the amount of medicine that reaches your bloodstream after undergoing biological changes like absorption and metabolism. Here is a list of drugs that interact with grapefruit. Statins. These drugs are commonly prescribed for high cholesterol, bad cholesterol, and can be toxic to muscles, causing side effects ranging from mild muscle aches and weakness to severe conditions like rhabdomyolysis, which is the breakdown of muscle tissue. Grapefruit increases this risk since it increases the amount of statins in the bloodstream. If you're taking any of these drugs and experience muscle pain, weakness, or any discomfort, consult with your doctor and avoid grapefruit juice. Simvastatin, brand names include Zocor, Lipex, and Synvador. Atorvastatin, brand names include Lipitor, Atoris, Lortat. Lovastatin, brand names include Mevacor, Altoprev, and Altocor. Blood pressure medication. These drugs can cause dangerously low blood pressure when combined with grapefruit. If you're taking one of these drugs and you experience symptoms of dizziness, lightheadedness, fainting, nausea, blurred vision, and general weakness, seek medical attention and make sure to avoid grapefruit for as long as you are taking these. Amlodipine. Brand names include Norvasc, Diltiazem. Brand names include Cardizem and Tiazac. Nifedipine. Brand names include Procardia and Adalat. Verapamil. Brand names include Calan, Isoptin, and Verilan. Antiarrhythmic medications. Prescribed for abnormal heart rhythms, when combined with grapefruit, lead to a risk of severe heart rhythm problems. Amiodarone. Brand names include Pacerone, Cordarone, and Aratac. Quinidine. Brand names include Quinidex, Quinaglute, Cardioquin, and Quinora. Analgesics. Opioids, both natural and synthetic, interact with grapefruit in a way that increases the serum levels of opioids. If you are taking any opioid medication, don't drink grapefruit juice, and always consult with your healthcare provider about any safety concerns regarding opioid drug interactions. The opioids in question are alfentanil, fentanyl, sufentanil, buprenorphine, codeine, oxycodone, dextromethorphan. This drug does not have analgesic, pain-reducing properties. It is a cough suppressant found in many over-the-counter cold and cough medicines such as Robitussin, Vicks Dayquil Cough, and Vicks NyQuil Cough. It is also used recreationally, which is a major safety concern, especially among adolescents, exposing them to respiratory depression, loss of consciousness, and cardiac issues. Methadone, tramadol. Tramadol also comes in combination with other pain relievers, such as acetaminophen, the active substance in Tylenol, under brand names including Ultracet and Zaldiar. Anticoagulants, or blood thinners. These are substances that prevent the blood from clotting or slows down the process, and already come with a risk of bleeding, which is doubled if grapefruit is introduced. If you're taking one of these drugs and experience increased bruising, frequent nosebleeds, or heavier than usual menstrual bleeding, consult with your doctor immediately and avoid grapefruit juice. Warfarin. Brand names include Coumadin, Jantoven, Aldokumar, and Anasmol. Apixaban. Brands like Eliquis. Clopidogrel. Brands include Plavix. Rivaroxaban. Brands including Xarelto. Erectile dysfunction and urinary tract drugs. The product labels may not specifically list grapefruit as an interaction. However, grapefruit can lead to high drug levels by blocking the liver enzyme that breaks them down. This comes with an increased risk of hypotension or low blood pressure, which is a side effect of these drugs. So avoid grapefruit if you are taking one of these: sildenafil or Viagra, tamsulosin or Flomax, silodosin or Rapaflo, alfuzosin or uroxetral. Anxiolytics or anti-anxiety drugs, such as benzodiazepines, interact with grapefruit, increasing their serum levels. Research indicates that this effect can last for 3 days or more following the last glass of juice. Side effects include extreme drowsiness, confusion, and impaired coordination. Again, don't drink grapefruit juice if you're under an anxiolytic treatment. Drugs include all benzodiazepines and buspirone. Immunosuppressive drugs, used to treat autoimmune diseases where the body attacks its own tissues and to prevent the body from rejecting transplanted organs or bone marrow, also interact with grapefruit, increasing their dangerous side effects, such as infection. Immunosuppressive drugs include cyclosporin, Neoral, sirolimus, Rapamun, and tacrolimus, Prograf. Antihistamines. Fexofenadine, or Allegra, is an example of an over-the-counter antihistamine that interacts with grapefruit juice, as well as orange and apple juice. These can limit how much fexofenadine enters the bloodstream, which decreases the drug's effectiveness. It is recommended to keep an interval of at least 4 hours between taking Allegra and drinking fruit juice. Antibiotics. Macrolides, which is a class of antibiotics, interact with grape juice as well, increasing their risk of hepatotoxicity or liver damage. Commonly prescribed macrolides are azithromycin, Zithromax, clarithromycin, Biaxin, and erythromycin, Erythrocin. Other drugs that interact with grapefruit are HIV protease inhibitors, saquinavir, Invirase, ritonavir, Norvir, nelfinavir, Viracept, and amprenavir, a generase, hormones, ethinylestradiol, Orthocept and other brands, methylprednisolone, Medrol, and anti-cancer drugs such as cyclophosphamide, docetaxel, doxorubicin, and imatinib. As we have seen in this segment, grapefruit interacts with a large spectrum of medications. The best preventive measure is to avoid grapefruit if you are taking one or more of these drugs, and don't hesitate to ask questions to your healthcare provider. Drug interactions reduce the effectiveness of your treatment and increase the toxicity of the drugs you are taking. So I can't stress this enough. Consult with your doctor about any safety concerns and never stop a medication on your own.